Good evening. Thank you for joining us for Mainstream Live. I'm Michael Poppa, the Executive Director of Mainstream Coalition, and tonight I'm excited to be here with Kansas Senator Barbara Bollier. Hi, Dr. Bollier.
Good evening, and so good to be here, and welcome everybody.
Yes, and thank you so much for being with us this evening. Question I know on top of my mind and probably everyone else's, how are you? How are you holding up during this?
I am well, and as I say to everyone, doesn't that have a whole new meaning now, what that means? I will be honest, this is hard, and I have been in my home since I came back from the legislative session. We had to self-isolate for 2 weeks, and then I've just essentially done it ever since. Since my husband's a primary care physician and he has to go out every day, he's doing the shopping, which he's done always in the past anyway, but it's great. But then so I've been out one time in the car, and it's just very different. And we all do our work. We're learning new things. That's the good news and the challenge. But we've had personal friends who are on ventilators, and this is a very, very serious health crisis that isn't going to leave us. We will get through all this, but we're going to be dealing with this for a very long time. And we are just, there's going to be the before and the after, and we're now in the after of our world has changed. But with change comes opportunity. So I'm looking forward to that as well.
Excellent. Yes, our world has forever changed. And you said, looking forward to opportunity, or there is opportunity. What inspires you to get through the day on some of those hard days? Because I know we've all had them. I've had them.
Every day.
Easter was kind of tough for me and my family because, we Zoomed Easter dinner, but it was just a family on a screen, right? And there are a lot of people that have it a lot worse than I do, and I'm thankful that I am where I am and I'm able to work from home. But what gets you through some of those tough times?
For me, of course, it's family and support, and it's knowing that I have a job to do and I'm needed to do it. Being a state senator, I field calls and emails every day from constituents that have needs certainly much greater than my own, and being able to connect them to the right resources and help, that is very invigorating and inspiring for me. And I think I finally feel as a state senator, people know I'm there and are utilizing the help that I can give. I think we all also, for me, I really rely on my faith a lot, Michael. And I have a church here in town, Village Presbyterian Church, and, doing it stream live instead of in person. It's hard. I miss people, but at least there's a place to get that moral support and comfort that we all need when we can't physically connect, hug, touch, do that. And for, specifically for me with a doctor in the family, we're having to social distance in our home because he could bring something home every day. And that's been very difficult. And I'm ready for that not to be part of our lives, definitely.
I'm sure. Well, we're in the middle of a crisis, but I do want to know, what do you think is the most important issue right now facing Kansans and Americans?
Michael, interestingly, I think even though it is a pandemic, I would have had the same answer no matter what. And it comes from listening to people around the state and around the country. Healthcare is hands down the most important issue. We know it's too expensive and too complicated. And it's really one of the reasons that I got into being a public servant in the first place, starting with the Affordable Care Act and wanting to have someone at the table to help as a provider. And, just the accessibility, affordability, we know we need that in Kansas. And I was so disappointed this year that we weren't able to expand Medicaid, because there we are with 130,000+ Kansans who are in the middle of a pandemic and have no insurance and very likely won't access care. And that puts not only them, but all of us at risk. That's public health. It's why we get rated so low, because we don't have people covered in our state. And we must do better. We must help our children get what they need. We have to strengthen our local hospitals and our rural hospitals through Medicaid expansion. And, I've fought so hard to do this, and leaving that $3.5 billion out of our economy is going to come back to bite us now.
Yeah, and that just doesn't make sense when we could have protected so many people, protected our state.
Right. And so, I'm eager to get to Washington, and the pandemic has, shown us why a coordinated healthcare system really matters. And we need people to have access to care, and also the challenge of linking it to our employment. So I think we'll have to be reevaluating that specifically.
Dr. Bollier, you mentioned, getting to the federal level. So what's your opinion of federal, state, and the local responses that you've seen so far on the coronavirus pandemic?
Great question. So first, it's honestly been really unfortunate to see that the federal response it's been very confusing. Every day it kind of changes different things, and it's been inadequate. We know we haven't gotten supplies that we need. And when you have states competing against each other and the federal government for supplies, that is a problem. I really feel that we're very lucky that our state and our local officials have done an excellent job of doing their very best to reach out and protect us. They're encouraging us to follow CDC guidelines, which I think that's what we should look to, and have really been encouraging the whole social distancing process for all of us. I also will say I am so thankful for Governor Laura Kelly and Secretary Dr. Lee Norman. They have been rocks and rock stars during this time. And what I'm particularly pleased with, they were very swift and decisive and no nonsense about this. They made decisions. Not everybody liked all their decisions, but they were based on good factual information. And now we are seeing that Governor Kelly has become a leader for this country as a governor in this crisis. I will say the good news with all of us trying to working to get together, and I like how Missouri, Kansas, and Colorado have come together with governorships to make a plan, that working together is how we do get out of this together, and we will. So that's good.
Yes, we will definitely get out of this.
Yes.
Governor Kelly and Dr. Norman have been amazing, and they have been acting swiftly, as you said, very decisively.
Yes.
But I don't believe we've seen that on the federal level. What do you think could have been done differently?
Let's start going way back. We need infrastructure. We learned that in Kansas when we went through the Brownback years, and our infrastructure, our administrative level of government was so decimated. And we've been trying to get that put back in place, because it isn't too much government, but we need good government. We haven't had that at the federal level, just starting with the president's decision to eliminate the pandemic response team. And I mean, I think you can trace back to that. And then not listening to what was going on and recommendations being made by advisors, and not following science. That's, data and science matter. People have said this was coming someday. It's not like it was brand new news. I mean, it happened now, but people have been writing about and trying to get us prepared for this. So I wish we had done a better job of immediately recognizing the potential danger. Yeah, people say you maybe overreact, but overreaction produces great results for this, and then you don't have as many people sick. Not having tests, we still don't have the ability to move forward, and that traces back again to our federal government, who we buy our supplies from, on down the line. We really need to re-examine our whole role federally and what we should do, because there will be another. Viruses change and mutate.
So with all the disruption, especially in our local communities due to this pandemic, it's been from education to healthcare to the economy. What do you think is the most important next step to limit that long-term damage to Kansas?
Well, for next steps, the first thing we have to do is make sure and ensure that our families are having their basic needs met. Maslow's hierarchy of needs, but food, water, medicine, being able to pay the rent, their utility bills, or having them put on hold as needed. We have to also help get money directly into their pockets, and let's hope that can happen quickly, and that they can then be safe in their homes. The other thing is we really have to support and step up for our small businesses. That is true all over the country, but Kansas, our state, has primarily small businesses, and getting them the financial support that they need. I was really proud and pleased that when the feds were struggling to pass a relief bill, that the Democratic side stood up and said, we will not support this until it supports small businesses. And that is Kansans. That is who we are. We need that. And you and I both know, I'm a small business right now. You work in a small business. We operate on very close margins to the line. And so there's not great, we don't have a big reserve or anything. And so to be able to keep our employees paid, we've got to have the funds to do that. And we need a stimulus package that helps us, anyone in small business, be able to do that. And, we just have to demand better from our elected officials and make sure they get that to happen, and that we get the money to the people who need it the most. That's what my priority is.
And so then you mentioned getting money to the people who need it the most. So what would you prioritize, and maybe that would be the number one priority in the next coronavirus relief package? What would you see being number one priority, or how to prioritize that?
Well, again, small businesses and the people on those margins, living on the margins. One of the things that completely got left out thus far, and I've been very concerned about, and hearing from constituents and people and universities, our university system is in deep trouble, and they got nothing. So that needs to be looked at. And I also have heard from college students who, because they don't have jobs, they're not eligible for that payment that would come as if you're, quote, unemployed. And they're very nervous. Many of them were expecting to have summer jobs that just aren't going to exist. And we need to be able to help them and make sure they can eat and have a roof over their head. So it's people who are in need help. So we just have to make sure and be sure and look all across the board, and not just put money into too much big business. That we need businesses to be able to survive, but we need the funds actually getting down to the person. I think we learned a lesson from the last recession, that getting it into the hands of the actual people to get it back into the economy is what we need to be looking at.
Definitely. Speaking of unemployment, how do you think that politicians can help address the massive job losses and the economic crisis that's happening right now?
It is a huge issue, and obviously we went from having one of probably the lowest unemployment rates to now the highest ever. And I personally feel very privileged to be in a position. I'm elected, and we still have a job, and that isn't going away. But my job is to help people and to help them have access to places to seek, if they're unemployed, where can they get help getting employment. And I see our role I was very pleased this year in session, we passed legislation that will help put money towards people being retrained for jobs, because the sector's going to change. And so people are going to have to be looking for different things to do. We have need in the state, and we have the opportunity and something in place already through legislation to help people retrain. We just have to be sure also our leaders in Washington are looking for ways that they can help and get people the work that they need. And all of us are just going to have to be paying attention and saying, you know, how do we redo this? What new jobs are needed that we weren't thinking, and what ones maybe aren't as necessary, and we're going to have to retrain people for others that are. I do want to say that, you know, for me as a physician, I've always been about wanting to help people. And that's one of the reasons, and a huge reason why I went into public service is, again, to be able to help people. And so if anyone needs help with unemployment benefits, the paychecks that need to come, whatever it is, don't hesitate to reach out to me so that I can help you connect with those things.
Thank you. You know, we've seen a lot of elected officials and public officials across the country stepping up and actually rising above this, you know, and rising to the occasion. Some not so much. So what do you think would be the most important skill, or what is the most important skill for public officials to have at this time of crisis?
Well, crisis or no crisis, to me, the most important skill an elected official can have is listening. And, you know, I as a doctor, that's what we do. We listen to people so we can assess their situation. We also look at data and then collaborate with others and then come up with a plan for these people. So without a doubt, it starts with listening. And that's another way that we bring people together. When you're listening to them, you're taking the time, and listening is part of the whole overview of just communicating. If you're effectively communicating, you're not just hearing what the person that you're visiting with says, but you're understanding and being able to go back and reiterate to them, this is what I hear you saying, is this correct? And I think that's so important. The other thing that I don't always see from other elected officials that is so important to me is compassion. And, you know, being in the shoes of someone else and trying to have the empathy and understanding and compassion of what they need in their circumstances and help them along. You know I'm scared now. Kids are scared, people are scared, everyone's anxious, and having compassion for one another and showing kindness to, you know, everyone, our neighbors, people, that's something that we really need to see in our elected officials, because I think that's what makes us all best.
I agree.
Yeah.
And thank you for stating that, because it is true.
It is true.
Yes. We're clearly in a recession, right? Do you think that Kansas is in a good position to weather this storm?
Oh, good question. Well, I'll say we're in a better place than we were 3 years ago, without a doubt. You know, we went through the Brownback fiasco tax plan, and we not only weren't meeting our budget goals, we were having to borrow from ourselves. And thankfully, we have a new administration. We actually were the 2019 comeback state, Kansas was, because we've worked to reform some of our tax policy. We certainly are looking again at how we spend our money and where, and we're getting our infrastructure back in place. And, you know, we've tried very hard to have the constitutional amount in our reserves. We weren't always able to do that. Interestingly, the Republicans took that money out, but voted to move that down. But, we're in a better financial position, and this recession is going to have a huge, huge impact because as everyone's income drops, we won't have income tax. And as income drops, people won't be buying as many things. So we will have lower sales tax. And that people, it's a big, huge deal. And I'm just thankful that we have a very fiscally responsible governor and great leadership. And we're, as a legislature, have to go back and we're going to have to make some very strategic decisions about the money that we do have and how we want to plan for the future to get us back. It certainly, when we left the session, no one pictured this particular level of crisis. It just certainly economically, we knew something might come, but this is a huge, big deal and will need to be addressed.
Sure. And, as you mentioned, as we were talking about, we are in a recession, but we're also dealing with challenges right now of conducting primary elections during this pandemic. I mean, what we took for granted, being able to go to the polls and cast our vote, is very much in jeopardy right now. What do you think that Kansas should do to ensure that there's a safe and secure election that also encourages participation?
Well, and I'm going to give kudos to our state for some things. We have 3 weeks plus to vote. That is better than many states. We also have the ability to have a mail-in ballot without cause. You can just ask for it. And if people are concerned they're not going to want to go out in public at voting time, may not be able to, whatever, order a mail-in ballot and get it. And that's something that will ensure that you can vote. I want to be very clear that I want to be sure that we maintain the ability to vote on election day, no matter what. We don't want that right taken away. But giving people the option to do it otherwise is a really good thing. I will also give a shout out. Scott Schwab is working very hard to ensure that our elections are safe. He wants to do a good job for us. And I'm encouraged by his commitment to that office. I would say that we've had people in the past who have not been as eager to ensure that we all have our right to vote. And we need that in place. And I'm really encouraged that, our ability to have those advance and absentee ballots really will make a difference. And I encourage anybody now, go ahead and sign up, because you have nothing to lose. And just because you get an advance ballot in the mail, it doesn't mean you have to vote that way. If you haven't sent it in, you can bring it with you and still vote in person. So that way you have insurance no matter what.
Right. Now, for advance ballots, for mail ballots, traditionally or in the past, you've had to request for both the primary and the general. Yeah,
you have to do both.
And you still have to do both. They haven't changed that yet, as far as I understand.
Right. No, we haven't voted on anything like that. So that's still the same. Yeah. The Democratic Party just has had its primary for the president done by all mail-in ballots. Just right, and it's ongoing right now. So, and there are states like Washington State, they do all their elections, every part of it, by mail-in ballots. So I think we're going to see a huge move in this country to more and more mail-in ballot, and it just again really helps make sure everybody has that right to vote.
Right, and those are automatically mailed.
Yes, they're automatically. No one has to ask in those states. So that would be ideal.
Right. No one has to ask for their right to vote, right?
Yeah. Well, that's another topic of conversation.
That's the way it should be. Right.
Yeah. And we need to make sure we're, that's enough said. Okay. We have worries with, we don't want to move the election or anything, there are wild rumors out there about what the president might do. And we just need to make sure that we keep our elections safe, secure, and in place.
Excellent. Earlier, you did talk about education a little bit, and with so many children schooling online, schooling remotely, how important is it to expand rural broadband?
Oh, it is a huge issue in not only our state, it's all over the country. And when you talk of rural areas, you don't have to think about going that far from Kansas City, because there are areas right near here, right in Miami County, right even on the edges of Johnson County, that people don't have high-speed internet like they need. And that has been a tremendous issue for us and must come to the forefront. It's a huge part of what I want to see change when I go to Washington. And it doesn't only affect our schools, it affects rural life, period, in making sure people stay there if they want to live in a rural area. Of course, you need broadband. And to attract new people there, new businesses, if they don't have access, they're not very likely to go there. And last but not least, healthcare. And one of the good parts of the pandemic we're in right now, it has forced the healthcare system to jump in headfirst into telehealth and just move forward at a rate unprecedented, where people thought it would take 2 years to roll it out. It's been 2 weeks. But one of the limitations is broadband for some of those rural areas. So that's really, really important. And like I said, I feel very blessed that I'm here being able to work by Zoom and the internet. For those who are out in other areas and couldn't, I don't know what they can do in a crisis like this. So, and we all should be protected in a crisis to be able to have our needs met. I consider this a basic need.
Definitely.
Yeah.
So going back to this past legislative session, what do you think? Not this past. I know
we're not quite done yet. We don't know if we're done yet.
I just assume, like many, that it may be over for the year, but
we'll see.
Who knows? We'll see.
Yeah.
What do you think so far then has been the biggest missed opportunity in Topeka?
There's no doubt about that. It's Medicaid expansion, and I've already spoken about it, but it is a travesty, and it is a social justice travesty and moral imperative that people have access to healthcare. And I think we're going to see also from the pandemic with COVID, the people, I think we're going to be looking back and seeing the people who have been hurt the most by the virus and potentially died are people that have comorbid conditions, and some or all of that may have been contributed to by the fact they didn't have the preventive health care that they've needed all their lives. And just that's one of the goals and what we want in expanding Medicaid and even improving our healthcare system in general. We want to move from a response mode to a preventive mode and have good public health and good healthy people. And Medicaid expansion would help us do that. And as I said before, the huge loss for this year, again, if we don't get to go back and pass this, then it's going to be another year before it gets in place, which is really 2 years, because first you have to pass the legislation and then you have to get all the infrastructure set up. So that is not sustainable for our state. We have, my hope is that we do go back and we get this passed and move forward. Yeah.
If you are not able to fit, yes, obviously, hopefully we can get this done. Hopefully you can get this done this year. If you're not able to go back physically, do you see any way that the legislature could meet virtually? And I'm asking,
well, obviously,
have you thought about this?
I have thought about it. And well, one is, do all our legislators have broadband access that is adequate to do a meeting like this? I don't know the answer to that. We also have the issue, you would have, in my thinking, I think we would have to pass a law saying we could meet other than in person. So we have to be there to do that. So I'm not quite sure how that works legally. And so I have thought about it. And if we went ahead and did it without, like met and passed a law, then you wonder if there's going to be somebody filing a lawsuit saying that was illegal what you did, and then everything we do gets struck down. So greater minds than mine will be figuring this out. I am not a lawyer, but I know enough about the law that I know the law for us is that we have to be there. So
Right.
that is what my expectation is. If we go back, we'll have to physically be there.
So speaking about going back, or just legislature to speak in general, one last question, because I know that you do have another.
I have another engagement. Yes. Thomas County.
Another Zoom engagement. I'm sorry?
Thomas County out west. So it'll be interesting to hear their perspectives on this.
Sure.
And, yeah.
Well, I don't want to hold you up, and I want them to be able to hear you as well. But what was your take on this past Saturday Supreme Court ruling? First, watching oral arguments online, online.
Right.
Was
well,
surreal.
I was actually working, so I didn't have the opportunity to watch, but I could scroll back and do so. I was pleased that they stuck to the topic at hand, which was, what did the ruling we passed actually say? And they ruled on that just as they should have. And I know very well in my own vote, I voted for something to be looked at potentially by the Legislative Coordinating Council, the LCC, after May. And so I think they ruled appropriately. If there are other issues that come up about freedom of religion or religious oppression or whatever, that's for another day. If somebody feels that way, that would be a different issue at hand and a different challenge in the court. But right now for us in Kansas, we dealt with exactly what we needed to. And I'm very proud of our governor for making sure that we're safe.
And as we all are.
Yes.
Well, thank you so much for being with us this evening.
Oh,
I really appreciate your perspective and your time.
Thanks, Michael. And mainstream is near and dear to my heart. I've been a supporter for years on end. I have lived here in Kansas City and know, our tenets in mainstream of freedom of religion and making sure the separation of church and state, advocating for great public education, and ensuring our freedoms. And those are so important. And I really appreciate and know how much it means to us that you help maintain those very basic values and tenets that we hold so dear. So thanks to Mainstream for always being there for us.
Thank you very much. All right. And if there were any questions that constituents had for you, they can
feel free to holler.
Contact you. How?
Yes.
Okay.
Barbara Bollier, and spelled Bollier, and first name Barbara. And so Barbara Bollier is one word at gmail.com. Feel free to holler, and you can always go to any of my websites. All my information is there always, and I am available and accessible, and I'm here to help. Yeah.
Excellent.
Thanks.
Yes, and I can attest to that. Thank you so much. You have a wonderful evening.
You too. Thanks, Michael. Thanks for having me.
Take
Be
care.
well, everybody.
Anytime.